Today, even further up the food chain, the Director General of Health has resigned. Health Minister Dr David Clark acknowledges the resignation of Director General of Health Chuah. This is a quote in the media release from David Clark. David Clark is not talking. I'd like to thank him for his public service as Director General of Health since November 2013, and I respect his decision to finish earlier. Earlier this year, Mr Chuah came under fire for his part in a funding allocations botch-up, which saw 14 DHBs given too much funding, while 6 DHBs were shortchanged. Almost 40 million as assigned incorrectly across the country, including almost 3 million at the Canterbury DHB. One of the board members on the Canterbury DHB is Jo Kane. She called for Mr Chuah's resignation in June, and she joins us now live. Are you there, Jo?
Yes, hi John.
Hello, nice to talk to you.
Oh yeah, well it's look, what happens on these health boards is you're usually not allowed to talk, and nobody ever does, and so what has gone on for such a long period of time is kind of swept under the counter.
Okay.
But I'm kind of sick of it, so I'm quite happy to talk.
Right, well you're live on air, so we're delighted about that. Thank you so much. Can we talk about the particular and the thing that really got your back up, which was the funding era, and it was a disaster really, and also the response to it. What was at stake when you called for Chuah to resign in June? Well,
it was a chapter of events. Don't forget that the MOH and their financials of their own building were found very short, of which he led. But for me, it was a last straw in the engagement and the leadership that he was meant to show for Canterbury. And it was just like, how can you be stomping all over us and yet, you know, you need to have a good look in the mirror, is what I felt. And I haven't had any confidence, that I'm talking to me, in that leadership or the relationship that we had with him. And it's very, very interesting that David Clark, it's exactly words that he's used.
Can you explain that? Sorry, your line's dropping out a bit.
If you look at the press release,
yeah,
he's saying that what is needed is actually leadership and relationships. Well, it was more to do with the relationships and the partnership that health boards should have with the MOH. And, you know, for us in Canterbury, it's the lack of that engagement for years and years. And it's almost if you're in, you win. If you're not, you struggled.
Okay,
and
now have you been?
That's just what happened.
But my sense, and anyone who listens to Checkpoint regularly will know, we've spent an enormous amount of time covering the DHBs, the position they're in, the relationship with the minister, the relationship with the ministry. My sense is that across the board, almost without exception, although there are a couple of DHBs who will contradict me, there has been an increasingly tense relationship between DHBs, our major hospitals, and the ministry under Chuah. Is that your sense of it?
Absolutely, that's exactly. And all we really asked, I mean, I'm an elected official, all we asked was come to the table, look at the data, and explain to us why you keep seeing things that are so at odds with us. But then when you look around the country, John, there are other health boards, and what they do is they played winners and losers. As I said, if you were in, you won. So if you were on side with the ministry and everything, you got your funding. If you weren't, of which we happen to be one, but we're not the only one, you just hit a brick wall. And I you know, my kind of thought on this was when chief executives are in such powerful positions, I wondered what was he advising on behalf of Canterbury to the then minister, and I'm not convinced that it was correct.
How much pressure were you under in terms of the KPIs around fiscal performance?
Almost out the door pressure. We have been threatened. That is what come back, is that the board will be dismissed. We've had financial reviews with PwC, and even though there were figures in there that were incorrect, that we've had to have a second review, that actually found us financially sustainable. So a lot of the rhetoric that happened around Canterbury is really simple, John, and this is what I find so irritating. There's a funding model, and it's either good, you know, it's what we all work under. We're just asking in Canterbury for our fair share. Forget the earthquakes, all right? Just forget the earthquakes. Just give us what our population-based funding is. And, you know, we threw our stats at them, and we got a different answer. And that's not how it works.
I've just got a statement here from the State Services Commissioner Peter Hughes, you're right about the language that David Clark used. It's sort of repeated here. I'm just reading through it at high speed. But Peter Hughes says, Mr Chuah advised me at the end of July that he was considering stepping down before the end of his term. I guess he would have anticipated the possibility for a change of minister, because he seems to have been strongly aligned with Jonathan Coleman and might have reasonably had the expectation that he wouldn't have been as close to whoever the next minister might have been. But that's hypothesis by me. But Peter Hughes goes on, he has long held the view that it is critical that the health sector is unified in meeting the challenges ahead. Are you saying that you don't think Chuah was unifying the health sector?
Oh, absolutely not. Absolutely not. I'm not isolated here in Canterbury. I talk to other board members around the country, and I tell you, that's the key elements that I think we're missing: leadership, relationships, and a partnership. So we should be in a partnership. So you should be able to explain, hey, here's a problem that we've got, and not actually, it's almost combative with the behaviour back from that, it's not just size. There's a team there that, in my opinion, it's like, well, I hope there's going to be a little bit of a little soul searching in there, because it's just not good enough for the rest of the country.
Jo Kane, who made the highly unusual move of calling for Chuah to resign in June and is one of the few people prepared to speak on the record today. Thank you so much, Jo, who is a board member of the Canterbury District Health Board. Obviously, Peter Hughes has put out a statement, the State Services Commissioner, the Health Minister, David Clark, has put out a statement. We really would love to talk to them, because they are saying this is part of an evolutionary process, that Chuah has done good work, but it is time to move on. We'd like to hear that from the horse's mouth, really, Peter Hughes or Dr. David Clark. We'd really like it if you were available to join us on Checkpoint, Chuah himself. We have been covering DHBs at length over the past few months, and we have heard from DHB after DHB that there is a very tense relationship between what they call Wellington and the district health boards throughout the country. We would like to talk about this in the context of Chuah's resignation.